So we'll continue our talk about the CBT, and this is the last session for CBT for addiction. So through this session, you learn some exercises that help you to recover from addiction, whatever it is, behavioral addiction like gambling, pornography, food, work, relationships, or alcohol or drugs. Okay, the focus today is two things and the two exercises. We're going to talk about something called the triggers and something called the cravings. Okay, and the exercise that we have two exercises today. One exercise to identify the triggers and how you're going to cope with them, and how to cope with the craving. So to start working with this exercise, you need to know the difference between triggers and the craving. Triggers is what stimulate a desire. Craving is the desire. Okay, so trigger is any experience that stimulate a desire to reuse the drug or drink or involve in any behavioral addiction. This trigger could be people, places, situation. Sometimes we call it inner trigger, which is the feeling like loneliness, grief, depression, frustration. It could be a place like club or bars, could be family members, friends, relatives. It could be things that remind you of how you use drugs, like a spoon or a lighter or needles. These triggers can lead to relapse. Craving is something different. Craving is an urge or a desire to use the substance or alcohol, and the craving include a desire, like a psychological need, also some thoughts and the memories of using. Okay, sometimes the physical symptoms like heart palpitation, sweating, sometimes the behavior like bathing. So we call all of this craving. Again, we have two exercises: the triggers, identify triggers, and learn how to cope with the craving. So this exercise will increase your awareness of potential triggers and identify some positive coping techniques with these triggers. Okay, so the first exercise, I want you to list at least 10 things, okay, that could be a potential trigger. It could be people, places, things, situation, anything that stimulate a desire to use. Okay, location, family members, strong negative emotions, or sometimes positive emotion, as we learned last session, like celebration could be a positive emotion that trigger relapse. Or financial situation. Sometimes more money can trigger relapse, less money trigger relapse too. So you'll tell me about 10 things that could be a trigger. And another part of this exercise, you tell me how you're gonna cope with these triggers. So if you list 10 things, okay, if you can't think about 10 triggers, 5 is enough, 3 is enough. Like, tell me what is the most common triggers that you struggle with. Okay, and then I want you to write a positive way that you can cope with these triggers. You can consider this stuff, to deal with the triggers. By the way, some triggers are unavoidable and some triggers you can avoid, like going to a bar. This is something you can avoid. So you can avoid high-risk people, places, event. Someone like me, I have food addiction. Okay, trigger is food, but this is you can tell me, okay, you avoid foods with high carbohydrate. I have 3 kids, and kids food usually involve lots of carbohydrate, so even fruits with high glycemic index. So for me it is unavoidable trigger, so I need to find a different way to cope with these triggers. The same thing with whatever is the addiction you struggle with, you need to consider, maybe avoid the trigger, especially at the beginning of recovery. If you can't avoid the triggers, like distract yourself, call a friend, read about recovery, spend time more with sober people, do more counseling. Prayers and religious practices can help as well. And also practice ahead of time how to refuse food offers or substance offers or sex offer or all these offers. So have an answer ready if you know you are going to a place where you're gonna get offered with this addictive substance or alcohol. For example, this guy struggled with alcohol addiction, so he has an answer ready, like no thanks, I don't drink anymore, or no thanks, I'm driving, or no thanks, I'm on diet, or no thanks, I'm alcoholic. Whatever, you set a plan on how you're gonna respond when people offer you something you are addicted to. Okay, and agree with your partner or your friend if you that you're gonna leave if you feel uncomfortable. Okay, another reminder, the triggers, by the way, could be external or internal. It could be feeling like something inside. So if your triggers is usually something inside, not outside, tell me how you're gonna cope with them. So this is the first exercise. Okay, easy. List 10 triggers, or at least like 5 triggers, and how you're gonna cope with them, with these triggers. If you can avoid them, it's better. If you can't, what else you can do to cope with them. Anyway, as a second exercise about the craving, I told you craving is a strong desire. Okay, this is part of recovery. Craving will happen, especially the first 3 months, is the worst 3 months after quitting any addictive substance. You will have lots of craving with trigger or without triggers. Okay, that's the good thing about craving. It lasts few minutes. If you can do something with the craving within these few minutes, like do pull up, push up, do something about it, you will be able to ride it out. But anyway, we will learn some techniques how to manage craving. You see this, we have a trigger cause craving, it end up with use. Okay, usually when there is a trigger, part of the craving is also thoughts. You recall the effect of the drug, you recall the positive memories, you think about reusing, okay, or taking just one drink or one joint. So there is thinking, so there is feeling. It's like you love someone, okay, there is a attraction toward the addictive substance, but also there is thoughts in the background running. We will try to work. We can't do anything about this feeling. It's gonna happen again, especially at early recovery. What we can control is the thoughts that are associated with craving and the thoughts of reusing drugs. Okay, so you see, when you have these thoughts and the craving, you will have physiological responses. It is not just psychological desire, a physical desire too. You'll have heart rate increase, energy, excitement. Anyway, we have to interrupt the thoughts. So we will work more on how to stop the thoughts. And again, relapse, when I talk about relapse, it's not just drugs or alcohol, it is also behavioral addiction. And I'm sure, I would say 60 or 70% of people have addiction to something, some sort of something. However, like addiction definition and diagnosis is needs certain criteria, but I would say lots of people have the genetic predisposition to get addicted to something. How to stop the thoughts? Okay, some people will write them down. Okay, some people will remove themselves from the situation. Some people will do something to distract, like go for a walk, work out, clean the house, do something, or have a list of people that you can call, which is easy with addiction, drugs and alcohol. There is a list of like a sponsor. You have a phone number, you can call them, or try relaxation technique. or keep a record of how you have coped in the past. This is important too. Sometimes when you have a strong craving, you forget what you did in the past. You forget what you did in the past and what you used to cope with these cravings. So if you have like a small card or a paper and a piece of paper, you write down things that worked with you in the past so you can read it and do it. And again, some people would use rubber band snap. Okay, I don't like it anyway, but keep this the last resort, the last option. And remember, craving is a normal part of recovery. Craving can be triggered by anything, and it can come out of nowhere, and it lasts for few minutes. Okay. Yeah. So I added in the slides that I sent some techniques for stress management. It is all biopsychosocial spiritual. We will not go into this exercise today because all the time we do a check-in regarding how you're doing physically, psychologically, socially, and spiritually. And these all are area we're gonna help you with the stress management. But our focus today is 2 questions again. How to stop the craving or the thoughts that are associated with the craving. This is one exercise. And another exercise is list few triggers that can trigger your addictive behavior and tell me how you're gonna cope with these triggers. Again, triggers and how you're gonna cope with them. Okay, and this is the last session about addiction. I think next time we will focus on, I think next time would be an anxiety. We're gonna talk how to use CBT for an anxiety. Thank you.